we saw how points located closer to the manifestations of pathologies work. Auricular points directly linked to the brain region of the origin of the vagus nerve, points that resolve muscle pain directly at the focus of the pain, points that resolve mental illness that manifest themselves through somatization and contraction in the face head due to the face feedback mechanism. Tinnitus being resolved with nerve stimulation linked directly to the nerve responsible for the contraction of the tensor tympani muscle. Rhinitis and sinusitis through stimuli that connect directly to the sinuses. All of these conditions are treated with points connected proximal to the origin of the problem. Now let's talk about distant points of the organs to be cured. How do we explain points located in the legs treat gastric imbalance? Or how do points on the hands influence the heart rate, for example? This is all due to the somatosensory reflexes. This nervous system is made up of afferent and efferent nerve fibers. Afferent fibers carry stimuli from the outside, skin and muscles, to the spinal cord, more specifically to the nucleus of the solitary tract, NTS, while efferent fibers carry stimuli from the spinal cord to the organs. Depending on the region of the spinal cord in which the afferent fiber is stimulated, the response will occur in an efferent fiber of one system or another. As a whole, afferent fibers can connect to two regions of the spinal cord: caudal region of the solitary tract, mediocaudal region of the solitary tract. In the caudal nucleus of the solitary tract, there are neurons of the dorsal nucleus of the vagus nerve and are responsible for the efferent nerve fibers of the parasympathetic system. In the mediocaudal part of the solitary tract, we will find neurons of the rostral ventrolateral medulla responsible for efferent stimuli related to the sympathetic system. Thus, depending on the region of the body where we insert needles, nerve stimuli go up to the spinal cord and trigger stimuli that go down to the organs. These stimuli can be linked to the sympathetic or parasympathetic system. Studies in humans and animals shows that, as a whole, stimuli to the hind legs, paws, increase vagal parasympathetic response, while stimuli in area of the abdomen have response from the sympathetic systems. As a good example of acupoints on the same channel but with opposite effects are the ST36 and ST25. While Zuzanli, located just below the knee patella, stimulates the parasympathetic system, Tianshu, located lateral to the navel, has a sympathetic system response on the organs. Following the example above, I leave you with an important tip when choosing the points to be stimulated. I personally follow the rule that the less the better. We must needle the points that are already known to be effective. Avoid too many needles, precisely to avoid unexpected or even unknown effects. Imagine an acupuncturist who used ST36 and ST25 simultaneously, just because he thinks that because they are from the stomach channel, they would have similar effects. The effects on the patients would cancel each other out in order to stimulate parasympathetic and sympathetic system at the same time. Take advantage of the fact that we are talking about symptoms of the digestive system. I now bring the points to be used as antiemetic, ST36, with all its parasympathetic effects that stimulate digestion, added to PC6-NEI1, a point located tuctum proximal to the fold of the wrist between the tendons palmaris longus and flexor carpi radialis. As we are on the subject of the somatosensory system, I will bring you a real episode that demonstrates the similarities even with animals. There is a pathological condition known as overactive bladder. In this condition, very prevalent in children, there is the urge to urinate very repeatedly. Even if the bladder is not full, the urge to urinate appears. This for no apparent reason. No urinary infections or anatomic defects. To treat these cases, we use parasacral electrostimulation through the same afferent somatosensory effect. We can achieve bladder relaxation and improvement in overactive bladder conditions. In these cases, we use points lateral to the third sacral vertebra. There is extensive literature proving the effectiveness of applying tense transcutaneous electrical nerve stimulation in this parasacral region. We will most effectively use needles on the Zimbian bladder 54 acupoints in the center of the glute, or Tunzong, a point lateral to that. The same points are very useful for treating men who suffer from benign prostatic hyperplasia and suffer from the urge to urinate repeatedly and constantly. I've treated a dog, old one, with urinary problems, needling the sacral region similar to humans, and it was effective, even in a dog.